As Ghana joined the world to mark World Malaria Day, the West African Center for Cell Biology of Infectious Pathogens, WACCBIP, organized free health screening in Choko, Accra, to promote total eradication of malaria. The event forms part of ongoing efforts to achieve health targets under the Sustainable Development Goals. In an interview with TV Africa, a senior researcher at WACCBIP, Dr. Yao Aniwe, calls on government to equip CHIPS compound nationwide with medical tools and mosquito nets to improve healthcare access.
In our communities, especially in the villages, let us make sure that all the chief compounds are well equipped. They have the basic resources that will allow them, whether we like it or not. The major reported cases going into the chief compounds are mostly malaria. Let us help them, empower them. The other thing is, so personnel-wise, let us keep training more people who will also offer not just the clinical remedies or interventions, but then also engaging the community to let them understand the impact of malaria. I believe over the years, government has contributed greater effort, and we appreciate it. There is government, there is the people, but without the people, there is no government. You govern people. Please, one life lost is hefty enough to cause us to look deeper into investing more into malaria and eradicating it. We need drugs, we need vaccines, and we need also the mosquito net.
He also urged the public to use mosquito nets properly, warning against turning them into football goalposts or refuse covers.
The other thing that we need you effortlessly to do is to make sure that the mosquito nets you have received are used for the purpose for which it was given you. The mosquito nets are to prevent you from getting bitten by mosquitoes. So one thing is a sleep under treated mosquito nets. Don't use them for goalposts and don't use them for any other thing. They are strictly meant to prevent insects and mosquitoes from biting you in your sleep.
A research fellow and spokesperson for the Ghana Association of Medical Laboratory Scientists, Dr. Gloria Amegache, cautioned against self-medication. She advised Ghanaians to seek proper diagnosis from certified laboratory professionals and keep their surroundings clean to prevent mosquito breeding.
What we are not doing right is doing self-medication, not really going to the hospital and get tested. There's a need for us to test, for us to be able to know that indeed you've been exposed to the parasite. Then having been exposed to the parasite, then the right treatment will be given to you, and then we'll be able to eliminate it. Because we really want to accelerate the fight against malaria for an equitable world. So without testing and treating, we'll not be able to eliminate. So there's a need for us to test. And we can't just be home and be doing self-medication. No, we need to go to the hospitals, the clinics, get tested, and then be treated. It's the medical laboratory scientists or the researchers in research facilities that will be able to do the testing. So obviously the tools to work with are very, very important. We're asking for the government and NGOs to make sure that they give us the necessary logistics that we need to work with. So the laboratories are equipped with the tools that we need, with the kit, the diagnostics that you can see behind me. We are doing RDT. So the point of care test kits is very, very important. To my right, you're seeing the lamp assays, a diagnostic way, molecular way of easily identifying the parasite. So it's very, very important. So all these logistics being available for us, we'll be able to work and we'll be able to treat and identify the parasite, and then the right treatment will be given.